PA Medi Medicare Counseling welcomes you to our virtual presentation. I am Elaine Muntzer, a volunteer counselor with the program, and I am joined today by Lorraine Williams, also a volunteer counselor. PA Medi is the name for Pennsylvania's State Health Insurance Assistance Program, known as a SHIP. SHIPs are available in every state. PA Medi offers free health benefits counseling to Medicare beneficiaries and their families or caregivers. Our mission is to educate, advocate, counsel, and empower people to make informed healthcare benefit decisions. PA Medi is an independent program funded by federal agencies and is not affiliated in any way with the insurance industry. PA Medi staff and volunteer counselors are certified by the Pennsylvania Department of Aging. Our counselors are highly trained and well qualified to help beneficiaries understand their health care coverage options. PA Medi counselors provide free, unbiased services personalized to your individual medical insurance needs. In addition to counseling, the PA Medi program focuses on community education and outreach. All information gathered is strictly confidential. PA Medi counselors can explain the 4 different parts of Medicare, parts A, B, C, and D. We can discuss and compare available Medicare Advantage plans. We can provide education on Medicare supplements, also known as Medigap plans, and provide information about Part D prescription drug plans, also known as PDPs. We can screen for financially based eligibility programs, including Pennsylvania PACE and PACENet, Federal Extra Help or Low Income Subsidy, and Medicare Savings Programs, known as MSPs. PA Medi counselors can inform beneficiaries of their options during the annual open enrollment period from October 15th through December 7th. We can assist with program enrollments. You can find your local PA Medi office by calling 800-783-7067 or look for this number on the back of your Medicare and You book. The Bucks County PA Medi program currently has approximately 20 Medicare counselors. Counselors provide one-on-one counseling to Medicare beneficiaries and their family members or their representatives. Counseling sessions are provided throughout the year with additional sessions available during the annual open enrollment period from October 15th to December 7th. Your questions can be answered by phone at any time during business hours, Monday through Friday, 8:30 a.m. to 4:30 p.m. Counseling usually takes place at public locations such as senior centers and libraries throughout Bucks County. However, during COVID-19, all counseling is being done by phone or virtually. To ask a question or schedule an appointment, please call the Bucks County PA Medi program today at 267-880-5700. This program is sponsored by the Bucks County Area Agency on Aging. I will now turn the session over to Lorraine Williams, who will begin by discussing Medicare Parts A and B.
Thank you, Elaine. Like you just said, we're going to start with the Medicare Parts A and B. You'll want to know how and when should I enroll in Medicare. You're eligible on your 65th birthday or the 25th month of disability, so you do not have to be retired to receive Medicare. Social Security automatically sends out Medicare cards to those eligible if they are receiving Social Security or Railroad Retirement, Social Security Disability, eligible on the 25th month of disability, or Supplemental Security Income, also known as SSI. If you do not receive the benefits I just spoke of, you can apply at a Social Security office or online at www.ssa.gov/benefits. You can apply 3 months before your 65th birthday, and if you do that, you would receive the benefits on the first day of your birthday month. If you apply the month of that you turn 65, you'll receive the benefits the following month. And you have up to 3 months after you turn 65, but you would receive the benefits at a significant delay in coverage. Let's talk about Medicare enrollment and your employer coverage. You're asking, is Part B needed? Well, if you or your spouse are actively employed and have creditable employer health insurance, you do not need to enroll into Part B. But when your employer coverage ends, you have 8 months to sign up for Part B without penalty. If your employer has less than 20 employees, you will need to enroll. Part A coverage is known as hospital insurance. Medicare pays 80% of the hospital care. There is a $1,484 deductible for 2021 for each benefit period. Part B coverage is known as medical insurance, and Medicare pays 80% of outpatient medical coverage, and there is a $203 annual deductible for 2021. Okay, how much does A and B cost? The Part A premium is based on your employment history. If you worked 40 quarters, which equals 10 years or more, it's free as you paid for it through payroll taxes. The Part B premium is $148.50 per month for 2021. This must be paid to get Original Medicare, a Medicare supplement, or a Medicare Advantage plan. It may be paid by the state if you meet financial eligible criteria, such as the Medicare Savings Programs. It may cost more if you have a higher income level. Here are some ways to apply for Medicare savings programs. You can receive assistance from a PA Medi counselor. You can complete a Medicare savings program paper application. You can apply online through Pennsylvania Department of Public Assistance at www.compass.state.pa.us. You can contact Benefits Data Trust for application assistance at 800-866-1807. So if you have a question or you would like to schedule an individual appointment, please call the Bucks County PA Medi today at 267-880-5700. Now we'll move on to Medicare options, and there are 2 of them. The first option is Medicare Supplemental Insurance, also known as Medigap insurance. Medigap covers Medicare co-pays, co-insurance, and deductibles. The Part B deductible is not covered except if you were grandfathered into plans C and F. It is provided by private insurance companies. You'll have monthly premiums, which will vary by company. You'll have plan types that are standardized by federal regulations, and you cannot be dropped from a plan unless you fail to pay the premium. You have a guaranteed issue period. It begins at age 65 when you enroll into Part B medical insurance. The insurance companies are not allowed to question you about pre-existing conditions. Medicare beneficiaries are given supplemental plan guaranteed insurance rights after retirement from a place of employment with creditable health insurance. How do you enroll in a Medigap policy? The PA Medi program can assist you in providing insurance company names and their phone numbers and provide cost estimates through the CSG actuarial data system. Or you can contact private insurance companies or Medicare brokers directly. The second option is the Medicare Advantage plans, which are known as Part C, and they consist of HMOs or PPOs. It is a method of choosing Medicare insurance, which is provided through private insurance companies. You will still have Medicare. They usually have fees associated with it, such as co-pays, co-insurance, and deductibles. It covers the same services as original Medicare, which is Part A, Part B, and most cover Part D. It may cover some extra benefits such as hearing, vision, or dental. You can choose from several managed care structures. HMO, which stands for Health Maintenance Organization, or PPOs, Preferred Provider Organization. You may sign up on Medicare.gov, have assistance from the PA Medi program, or private insurance companies, or a Medicare broker. You can change plans each year during the annual open enrollment, which again is October 15th through December 7th. What are the costs of Plan C? Well, costs vary by insurance companies. Most involve deductibles, co-pays, and or co-insurances. Monthly premiums can be as low as $0 per month. But please note, you cannot purchase a Medicare supplement insurance plan if you purchase a Medicare Advantage plan, Part C plan. So let's compare Medigaps versus Medicare Advantage plans. The Medigaps can be used with any provider that accepts Medicare. There are no co-pays, co-insurance, or deductible, except Part B deductible, which is $203 in 2021, or the Plan N option. There are no referrals. Coverage is standard by plan letter. You may have underwriting if switching plans. It can be rejected for pre-existing medical conditions. Drug plans must be purchased separately, and you can switch your drug plan each year. And you can only be dropped for failure to pay the premium. And now the Medicare Advantage plans, they consist of HMOs or PPOs. Plans are usually local and have an assigned network of providers. They usually include a drug plan. The monthly premium is usually much less than a Medigap plus Part D premiums. You'll have co-pays, deductibles, and or co-insurance, and benefits vary company to company. You can change plans yearly during the annual open enrollment period. You may get extra benefits such as the hearing, dental, or vision. Sometimes it will cost extra. Not all doctors, hospitals, or providers accept all Medicare Advantage plans, and they will have a maximum out-of-pocket cost, usually $7,500 or $11,300. So let's review your two Medicare options. Original Medicare, you will receive a red, white, and blue card, which contains the Part A hospital, Part B medical, plus you would have a prescription drug plan known as Part D, plus you have the option to purchase a Medigap policy. They are known as plans from A through N, or if you have a retiree, Medicaid, TRICARE, or veterans policy. versus Medicare Advantage plans, also known as Part C, and that is made up of HMOs and PPOs. You will use the insurance company's card that they provided to you. It includes Medicare Part A, hospital, Part B, medical, and Part D, prescription drug plan. Part C, which is provided by private insurance companies that are approved by Medicare. It must use plan network doctors and hospitals or you will pay more. Some plans charge a monthly premium. You will likely pay deductibles, copays, and/or coinsurances for covered services. You must use the Part C drug plan. Feel free to contact the following resource information services. Call the Bucks County PA Medi for information and/or an individual counseling appointment at 267-880-5700 or the Medicare website at www.medicare.gov. Finally, you can give them a call at 800-633-4227. Again, if you have any questions or you would like to schedule an individual appointment, please call the Bucks County PA Medi today at 267-880-5700.
Thank you, Lorraine. This is Elaine again, and I am going to review Medicare Part D prescription drug coverage. Part D prescription drug plans are designed to help with the cost of prescription drugs. If you have original Medicare, you need a Part D plan, also known as a PDP, because original Medicare and Medigap supplement plans do not include prescription drug coverage. The drug plans have a separate monthly premium, deductible, and copays for most drugs. Most Medicare Advantage plans, the Part C HMOs or PPOs, provide drug coverage within the plan and may have deductibles and copays. When should you enroll in a Part D drug plan? You can enroll during your initial enrollment period, which, as you remember, is based around your 65th birthday or your 25th month of Social Security disability, or during a special enrollment period, such as when you retire and lose your group health insurance coverage. You can enroll during the annual open enrollment period from October 15th to December 7th. Please be aware that you may incur a lifetime financial penalty if you do not enroll during your initial or a special enrollment period. And also be aware that you may change your Part D plan yearly during the annual open enrollment period. You can enroll in a Part D prescription drug plan with assistance from PA Medi program counselors on the Medicare.gov website plan finder or through private insurance companies or Medicare brokers. You do not need to enroll in a Part D if you receive veterans benefits, Pennsylvania PACE or PACENet, if you have an employer or retiree prescription plan with equivalent known as creditable coverage, or have a federal employee health benefit drug plan. Assistance with costs is available through the Extra Help Program, a federal program also called Low Income Subsidy. This program helps low-income Medicare beneficiaries dramatically lower their prescription drug costs. You may be eligible for extra help if you meet certain financial income and asset limits, which change yearly. If you receive Medicare Savings Program for Medicare Part B premium assistance, and you will be eligible for extra help if you receive SSI benefits or have both Medicare and Medicaid. To apply for extra help, you can receive assistance from a PA Medi program counselor. You can apply online at the official Social Security Administration site. You can request an extra help program paper application from Social Security, or you can call Benefits Data Trust at 800-866-1807. Pennsylvania has its own program funded by our state lottery called PACE and PACENet to provide help with prescription drug costs. Eligibility criteria for PACE and PACENet is that you are 65 years of age or older, a resident of Pennsylvania for at least 90 days, not receiving prescription drug benefits under medical assistance, and meet the PACENet income guidelines. Please be aware that there are only income, not asset eligibility guidelines, and the income guidelines are higher than the federal extra help, so it is always wise to ask about this program. How do you apply for PACE or PACENet? PA Medi can mail you a PACE and PACENet application, which you complete and mail back. You can call PACE directly at 1-800-225-7223, or you can call Benefits Data Trust at their 800-866-1807 number. Thank you very much for listening to our virtual presentation on Medicare. To ask a question or schedule an appointment, please call the Bucks County PA Medi program today at 267-880-5700. This program is sponsored by the Bucks County Area Agency on Aging. For Lorraine Williams and Elaine Munzer, thank you very much for listening, and please stay healthy. Thank you.